the one I'm talking about the solution. Okay, let's go. Next time. So what is the DHT?
Finasteride is a widely used oral medication that directly and systemically inhibits DHT, the primary cause of hair loss. However, its effectiveness varies among individuals.
One of the topic today is the one that block the DHT. As long as block the DHT, the scalp will holding the hairs.
50% of patients see noticeable improvement after 1 year of use. 15% of patients require 2 years to observe positive changes. 5% of patients may need to take it for up to 5 years to see results.
When you reach the DHT, the hair is going to thinner and weaker and falling down. How many hairs are falling down every day?
Considering the hair growth cycle, I typically advise patients that visible improvement requires at least 4 to 5 months, with a minimum treatment period of 6 months. As for optimal results, I recommend a treatment duration of 9 months to 1 year, followed by maintenance therapy.
Right. Mostly 70 hair is the normal. So can you go next step?
While significant changes may take time, many patients notice improvements under magnification cameras after just 3 to 4 months, which helps them stay committed to the treatment plan.
What is the one science of the hair growth? Can you help me to holding the mic, please?
Minoxidil, particularly the topical form branded as Rogaine, is one of the most commonly prescribed treatments worldwide, especially for women who cannot take oral medications like Finasteride. However, I stopped prescribing Minoxidil over 15 years ago due to several concerns.
Bottle is the one scalp, okay?
Additionally, information from reputable sources such as the Mayo Clinic highlights rare but serious side effects, including worsened hair loss in some cases, vision problems reported by some patients after prolonged use.
Can you see the falling down, right? Water going down is falling down, right? Can you see that? Just like that, right?
In 2024 alone, I encountered 9 new patients who reported vision deterioration after 6 months of Minoxidil use. Minoxidil accelerates the hair growth cycle for some users, causing hair to grow and shed more rapidly. While this may seem beneficial initially, it can shorten the lifespan of hair follicles, which can only produce approximately 20 cycles of hair in a lifetime.
So we do the treatment, okay?
Patients who used Minoxidil 4 or 5 to 6 years often reported that their hair volume had halved due to this accelerated cycle. Over my 17 years of experience treating thousands of patients who used Minoxidil, I have not encountered a single patient who experienced long-term improvement in their hair loss.
Or something solution. One of the product is the one Fiestra.
To avoid side effects like facial hair growth from topical Minoxidil, some patients turn to low-dose oral Minoxidil. However, this form carries significant risks and is classified as a black label, high-risk drug by the US FDA due to potential severe complications.
Let's block the hair growth. It means we stop losing the hair growth. This is one of the solutions. Does that make sense? Right?
It can cause fluid accumulation around the heart pericardial effusion, leading to reduced heart function and other serious cardiovascular issues.
The hair 25 times grew up. New baby hair grew up whole life. But if you use the Minoxidil,
Finasteride can be effective but requires patience and long-term commitment, 6 to 12 months minimum. Minoxidil poses risks such as scalp damage, accelerated follicle aging, vision problems, and potential heart complications in its.
So we put more Minoxidil in the scalp.
By understanding these risks and benefits, patients can make informed decisions about their hair loss treatments and focus on sustainable solutions for healthier results.
Another one is the one stem cell, PRP, exosome.